it's important for consumers to know that the drug shortages can affect you, their life or death. Yet we're not talking about just drugs that are rare or hardly used. Talking about common drugs, Arthel. So yes, albuterol, which treats asthma and can treat COPD or emphysema. Cancer drugs. We have chemotherapies, patients with cancer being denied treatments.
It was very nerve-wracking to, to be so close to the end and then kind of being told, oh, we gotta change things because we don't have the drug.
That was Ryan DeWars, a cancer patient and survivor who had to go on a journey to find a life-saving drug for his final rounds of chemotherapy. Now, it's just one example of a nationwide drug shortage forcing some hospitals to ration care, including for cancer and transplant patients. Let's bring in Dr. Frita Fisher now. She's certified in pediatrics, nephrology, and internal medicine. So, Dr. Frita, first of all, why is this happening?
Hi, Arthel. There are many reasons. One, there's been a severe cut in the price of generic drugs. The price has been cut by 50% since 2016, which is great for the consumer, but many pharmaceutical companies cannot bear the price cuts. And we even had a huge pharmaceutical company, Acorn, to shut down. That company makes albuterol, they make antibiotics. They actually are the only company that was making an antidote to lead poisoning. Also, we have supply chains that never quite recovered. The pandemic, yeah.
No, go ahead. You're talking about the supply chain and continue that. And also, when you jump back in, Dr. Frita, which drugs are in short supply? You mentioned albuterol. What else?
Yeah, we're not talking about just drugs that are rare or hardly used. Talking about common drugs, Arthel. So yes, albuterol, which treats asthma and can treat COPD or emphysema. Cancer drugs. We have chemotherapies, patients with cancer being denied treatments. Transplant medications, like for people with kidney transplants. If they don't have those medicines, they lose that kidney and they go back on dialysis or even worse. Antibiotics are in shortage. I could go on and back, over 300 drugs, according to the American Society of Health System Pharmaceuticals, are in shortage. It's the highest shortage we've had in 5 years.
Well, I want to play some sound right now from FDA Commissioner Dr. Robert Califf. Let's listen.
There's a need for greater transparency into the supply chains of our medical products to both improve resiliency and ensure continued access for critical medical products.
Boy, any solutions in sight, Dr. Fisher?
Well, reportedly, the Biden administration is actually coming up with a possible incentive, planning on giving tax incentives to some of the pharmaceutical companies, so perhaps they won't have to file bankruptcy and stop with the drugs, but also with the transparency. If we know in advance, then perhaps we won't get to this point where we're in this life or death shortage. Another thing is supply chains. We rely on countries like India, China for a lot of our pharmaceuticals, and quite frankly, it's cheaper in many cases to get the drugs from them. But when we cut those supply chains, like just recently, we cut a supply of 3 chemotherapy meds from India due to some protocol issues, but we're in severe shortage of those chemotherapy meds, and patients with cancer are suffering.
So, but you mentioned something, how, the U.S. is farming in, importing these drugs from elsewhere because they're too expensive here. So in about 40 seconds, if you could tell me then, and maybe this is not your lane, but I mean, the drug companies are saying we have a shortage, we can't produce it, but aren't their prices too high to begin with?
Well, yes, that's true, which is why the generic drugs, which are cheaper, it's great for us who purchase the drugs, but not great for the companies. One thought is that perhaps some of the buyers, and there are limited buyers, limited people who are making the big money, if they were to have some type of a consequence, that would be an incentive to make the drugs more readily available. But we have to hit this problem from all kinds of angles. Meanwhile, it's important for consumers to know that the drug shortages can affect you, their life or death. You can reach out to your senators, you can reach out to legislation or some nonprofit organizations if you're in a situation where you have a drug that you need that you can't get.
It's serious, and as you said, we have to remember the people are suffering in the meantime. Those are serious stats, but people are suffering the consequences. Dr. Frita Fisher, thank you very much. We'll see you again sometime soon. Thank you.